Hello everyone and welcome to this very brief presentation on preventing avoidable care home deaths. So we understand that of course our gorgeous people eventually may well pass away in our homes. So this is about preventable care home deaths, your falls, your falls, your medication errors, your choking, entrapments, etc. And there's all sorts of numerous, quite wonderful ways that sadly our residents can meet their demise. And so this presentation is about how to avoid that and avoiding being in front of the coroner. I know, God forbid that, I wouldn't wish that on anyone whatsoever. So we try our very best. And a lot of people sort of get themselves quite tied up, of course, in health and safety. They believe they've got to outsource it. And so at the end of this presentation, we're going to give you the resources and certainly the confidence that you can do it yourself. So today's presentation, I'm trying to keep it as short as I possibly can. I've recently delivered this at the Care Show London at Excel. It apparently went down well. The ukulele, of course, was present at the time. And for those viewers who saw you, it was lovely to see you. So we'll keep this short and sharp, and hopefully you'll get something from it. So obviously we're talking about trying to avoid things, and a lot of people do get themselves wrapped around the axle. And there's no great rocket science about health and safety. But then again, we've also got to recognize, the nature of our environments can be hazardous, particularly sort of falls, particularly sort of accessing areas that people shouldn't access. Our people themselves, some of them can be lack of experience, lack of competency, and I'm talking about in certain circumstances, nurses. Some of the equipment that we use, from hoists to baths, etc., can all play their own part in that. So, and of course, the nature of our clients themselves can have dementia, so they're less aware of their own surrounds and got less insight. So, for all those reasons, it can be quite a hazardous environment, and only the sort of statistics and certainly the news articles also play that out. And I don't need to go very far just to highlight some of this. We've got victims that have lain undiscovered for several hours. The poor residents, the three that died in Dorset, they believe at the time that was through carbon monoxide poisoning. Again, that wasn't fully confirmed, but that's what was suspected at the time. And of course, then you've got medication errors through nurses, or indeed people administering medication at the time. So there's a whole myriad of reasons that people can sadly have a premature death, or dare I say, be killed by the environment of our people that are there to look after them. And again, you don't have to go very far. You've got choking incidents. You've got thickener. Thickener is one of the ones I worry about the most, because sometimes we just assume all our staff are fully familiar with the ins and outs of it, and actually they're trained in it, and yet some will not be. I know from our own homes, there's been circumstances where carers just routinely are administering a thickener to residents that's not even prescribed. So if that can happen in good homes, it can happen in just about any homes. Falls from height again. I mean, these things now, even though it's well documented, you've got to have window restrictors on all the windows, that you can't access at any dangerous or inaccessible areas. These things are now sort of well documented, and yet these things are still happening, particularly in dementia, EMI, or indeed anyone's. Certainly the likes of maintenance man. I mean, that was one there, Ulverston Care Home, lift death. I mean, we've had in several incidents with lift firms. One particular chap who came in, he was a young chap, left the lift unattended, even though he had sort of barriers up, or should have had barriers up, and our head of housekeeping nearly stepped into an open lift. And I mean, that was a near miss. And yet, these things are routinely happening. So lifts are particularly dangerous. External fire escapes, access to basements, or indeed sort of garden areas where you might have sunken gardens, or indeed steps, are all potential fatal areas for our residents. Hoists, little old ears fall from hoists, particularly if they haven't been measured for them with an OT, or indeed the actual sling is incorrect for them. And you could go on. I mean, one of the ones in the previous one, there was schools. I mean, that was again hit the headlines last year with two horrendous accidents which happened, resulting in the death of a resident. You've also got resident on resident. I mean, last year you might have heard about the fatal beating with a gentleman onto another resident, and that's happened on 2 occasions. And it goes on. Lack of competency with staff, not able to do CPR, and it goes on and on. The big one that really keeps me up and really sort of stops me sleeping at night is fire. Fire is going to be, because all the previous ones have been in individual incidents that happen to affect an individual. This is the one though. This is the fire that not only will cause potential maximum fatalities, but also there is no doubt it will take you out of the business, both in terms of reputationally, but also physically. You will just not recover from that. And so it's the one that we need to be spending more time to make sure that we've got genuine drills in place, that our equipment in terms of means of detection that's properly addressable, and that also staff have got the confidence to fight fires. I mean, when you consider gone are the days where we used to tell our staff, just get people out. But the reality is, if you're in a home of 36, 46, or God forbid, even larger homes, then you're just not physically going to get all the residents out in time. So if you've got staff that have got confidence to tackle that fire in the initial stages, then that's fantastic. You're rocking and rolling. You've actually stopped it before it became a major issue. So practicing and giving the training of staff in use of fire extinguishers is far, far better than anything before, and making sure your fire doors. So the legislation has completely changed now. If you're still using fire risk assessors that are sort of rolling out the same old fire risk assessments as they were 2 years, 3 years ago, then you may well wish to sort of challenge them in terms of what has changed, because the legislation has seismically changed. Gone are the days where you used to have a degree of flexibility. It was almost like that balancing act of deciding, well, look, they're deficient in this area, but they've got an enhanced fire system here. Those days are now gone. And it's quite simply, are they compliant or not compliant? Are your fire doors compliant, particularly? Is your fire control system compliant? Is your staff training compliant? And it goes on. And it is quite clear that there's too many fire risk assessors out there that are not part of a register, that do not know the legislation well enough, and certainly they're just outdated. And so please, and if you're a care manager out there, please ensure you're getting someone else to do your fire risk assessment, because I'd humbly and respectfully say this is not a time for ChatGPT or indeed any sort of Google a fire risk assessment template. There's too much at risk, and it is a very technical basis. And this, of course, is in a post-Grenfell world. There's lots of examples. I mean, these are absolute horrendous examples of care home fires that have started. And I would also sort of say to you, ensure that you're fully aware that an increase is not just lithium batteries and rechargeable batteries. I've seen that with carers bringing in their bikes, putting them into hallways and bringing them into conservatories at the back of care homes. It's completely not permitted. It is such a high risk in terms of lithium fire, because you will not put them out with a fire extinguisher. But also solar panels. This particular one, I mean, this is I'll come back to solar panels in a second, but this, the worst care home fire in UK, this was in Glasgow, 2004. This was the Rose Park fire, and 14 gorgeous people there lost their lives. A lot of it was completely avoidable. They had fire doors which were fit for purpose. They had a fire system which was not interconnected. They had a completely mismatch between the zone plan and also the actual fire detectors. So it's showing you to the wrong place. On the evening itself, it was just agency on, and the fire brigade couldn't actually gain access to the home itself because it was taken around to a different entrance. It just went on and on. It was a catalogue of errors that resulted in the most horrific act of death, of fatal death, fatal accident right across the home. Most of these died within their beds, and it was the smoke inhalation, as most fires, which is the actual killer. And again, staff just not trained to deal with that. This is one recently. This was on the well sort of documented Courtfield Lodge fire, 6th of April, and again, the likely cause is the actual solar panels on the roof itself. So again, and that was it, just blew the distribution box within the main home. So if you've got solar panels, please inspect them and make sure they're fit for purpose, have been signed off once again. Because more and more of these coming to their natural end of life, 5-10 years, we've got cheap components in there. We are seeing more and more sort of solar panel induced fires, due to their age and their lack of maintenance. So things you need to do: make sure you've got a fit for purpose fire risk assessment. The Institute of Fire Safety Managers is one tier or one mechanism where they've got a register. It's a national register. Make sure they've also got insurance. Your fire doors, make sure your compartments between various rooms and various zones are fit for purpose. You haven't got great big gaping holes in them. And then inspect your fire doors routinely on a monthly basis and quarterly basis for a more detailed, in-depth. And certainly there are online courses which are more than fit for purpose to give your maintenance staff qualifications in inspecting fire doors. Make sure your fire extinguishers, again, are in date regularly. Do not use powder. That's a complete no-no now. It causes not just respiratory issues if you let it off in a confined space, but also you just can't see. And so please make sure your staff are suitably trained. Make sure you've got suitable and competent evacuation plans for your peats, and you understand your fire risks, and also your fire system regularly and quarterly tested and ideally addressable, so you know exactly the detector head which is operated when it goes off. So, as you know, you please invite people into the Care Managers Inner Circle. This is when I was on the presentation in the theatre. Said, look, if you're not part, come and see us, or all in our battle knickers, Care Managers Inner Circle. And so I invite them in. So there's a couple of things. There's about 6 things you actually need for an effective health and safety system. First, you just need a policy statement from you, the care manager, and indeed the owner, saying that you take safety seriously, and this is what you're going to do to keep people safe in your organisation. So you do need an annual statement of safety. Again, just use ChatGPT to find that out. Make sure you've got suitable risk assessments, and you communicate those, for the various risks. Again, if you're wondering where to start, then certainly one to start is HSG 220. So it's HSG 220. Which is on HSE website. Find that, and certainly that will give you a starter for the main risks that you find in a care home environment. Make sure you've got safe systems of work. That's just a 1 to 10 or 1 to 5 of how you're going to do that particular operation. Well, make sure you also, part of that, you manage your contractors on site, because your contractors are your Wild West. You don't know what they're up to. They're in areas of your building which are unsupervised, your basement, your attic, your confined space, and they're doing stuff which is a little bit more hazardous: electricity, gas, working at height, etc. Make sure your staff are trained. Certainly that's where a coroner would go. Anyone would go, are your staff trained to do what they're doing? It's our cat, Cedric. And also make sure you've got adequate record keeping. Ceddy, look. Say hello. And make sure then, wrapped around that, you've got effective management of health and safety, which is a routine heartbeat right across the organisation. One of the things that we do routinely is that when you see these awful accidents and incidents, I always use it, regardless what it is, as an opportunity for me just to recap that we're doing things correctly at Birkdale Park. So I just put that into Chat GP. That then creates a little poster for me, and I put that then in the staff room. And just finally, these are sort of things. So HSG 220 is the one on the right-hand side there, on safety in care homes. Again, you can just download that yourself. In the middle ground here, you've got all it is just an Excel register. I'll upload this to the Care Managers Inner Circle, and it just turns yellow when it's about 6 weeks out of whatever it is. So it might be Lola testing, it might be the fire extinguishers, it might be the fixed electrical, because health and safety is all date driven. And so you can see things, and it means that if you print this off at the start of the month, you're never going to be out of date. You're always on top of things. So things like your fire extinguishers, you don't suddenly find that they've lapsed several months ago. And then your bottom left-hand corner, you've got a safety cross. So all of our accidents and incidents there, a little cross or a little dot. just indicating there's an accident or incident. I'm going to say that was a very, some of these are behavioural from Rosemag. So again, not all accidents or incidents, but some of these are behavioural issues that we had. And then all again, I was put into chat GPT, and that then produced a summary of lessons identified across the board, and it was absolutely fantastic. So, ladies and gentlemen, I've just kept it short and sharp. Hopefully, that will give you. By all means, ask me any questions just on the website. But good to see you. I just wanted to keep it short. So please don't overthink things. It's relatively simple. If you just keep things in order, certainly, inspect your home, go around your home, take fire seriously, and try not to overcomplicate it. All right, see you soon. Bye then.